Good afternoon. Before we begin the program, we just want to go over some housekeeping guidelines for today's Google Meet. Please keep your phones muted. If you have a question, please type your question using the chat feature. This program will be recorded and posted on our website, hunterdonhealthcare.org, and also our social media pages. Like us on Facebook, Hunterdon Healthcare, and follow us on Twitter, Hunterdon Health. Thank you.
Today's virtual educational program is Don't Make Me Laugh, Treatment Options for Your Leaky Bladder. Our medical expert and presenter is Siobhán Hartigan, MD, a urologist for Hunterdon Urological Associates, specializing in female pelvic medicine and reconstructive surgery. Dr. Hartigan received her medical degree from George Washington University. She then went on to complete a general surgery internship and urology residency at the Hospital of the University of Pennsylvania. She completed further subspecialty fellowship training at Vanderbilt University Medical Center in female pelvic medicine, urogynecology, and both male and female urologic reconstructive surgery. We are pleased to welcome Dr. Hartigan.
Good afternoon, everyone. It's a pleasure to talk to you today about Don't Make Me Laugh, treatment options for your leaky bladder. Thank you for the lovely introduction. So, what is urinary incontinence? Urinary incontinence is also bladder leakage. It's the involuntary loss of urine or loss of bladder control. It's extremely common for both men and women. 1 in 2 adult women have some degree of urinary incontinence. But if it's so common, why don't we talk about it more? Why is there such a big business for incontinence products like poise pads, Depends, and those big aisles at the grocery store? There's a few reasons for that. Less than 50% of women with urinary incontinence discuss their symptoms with a healthcare provider. Several reasons for this are women might be ashamed or feel embarrassed about their symptoms. They might not seek immediate help for that. They might think that their symptoms are a natural part of aging, or they're unaware that their condition might be treatable. There are several different types of urinary incontinence. We're going to talk about the most common types of bladder leakage today: urge, stress, and mixed incontinence. All of these are very common. Of the 1 in 2 adult women who have incontinence, almost 50% have some degree of stress urinary incontinence, about a quarter have urge urinary incontinence, and also about a quarter have both. You might find yourself in one of these 3 categories. Urge urinary incontinence. This is the frequent or sudden urge to urinate that might be difficult to control. It's often associated with overactive bladder, which is a condition that we hear about a lot. Common symptoms of urge urinary incontinence are a strong or sudden desire to urinate, the unintentional loss of urine immediately or after that urgent need to urinate, if you urinate more than 8 times within a 24-hour period, or wake up more than 2 times at night to urinate. Causes of urinary urgency incontinence. Overactive bladder occurs because the muscles of the bladder start to contract involuntarily, even when the volume of urine in the bladder is low or before you desire to urinate. This is often seen as the gotta go, can't get to the bathroom in time leakage of urine. Or when you arrive home from the grocery store, put the key in the door, turn the key, and all of a sudden you're leaking urine before you get to the bathroom. Or if you wake up at night with the urge to go, but just don't make it to the bathroom in time. There are several causes. Some of those include any neurological disorder, such as a prior stroke, multiple sclerosis, Parkinson's disease, diabetes, while it affects many organs within the body, also very much affects the bladder. It's important to always control your other medical problems because you don't know how much of effect they really have on your urination as well. Urinary tract infections can lead to urgency urinary incontinence. However, sometimes this occurs even without the presence of a UTI, and oftentimes women are overtreated for urinary tract infections, and their incontinence is blamed on an infection. There are hormonal changes that happen during and after menopause that greatly contribute to the health of the bladder and leakage. There could also be significant abnormalities within the bladder, such as a bladder stone or a bladder tumor. Constipation can very much affect your bladder and inability to make it to the bathroom in time. And then, of course, any prior surgeries, such as pelvic or back surgery, can very much affect these things. There are additional other contributing factors. Medications. Other medicines that you're on that cause a rapid increase in urinary production, such as Lasix or other diuretics, can lead to incontinence. A large consumption of certain fluids or beverages can lead to incontinence. Declining cognitive function, especially due to aging. If you are someone that has difficulty walking or limited mobility, you might not be able to get to the bathroom in time. If you are not emptying your bladder all the way, it fills up more quickly, and this might lead to urgency urinary incontinence as well. You might also have some weak pelvic muscles from pregnancy or childbirth, or pelvic organ prolapse, which could be contributing. Or you might be excessively heavy and have some extra weight that could be contributing as well. The good news is there are many treatment options for urge urinary incontinence. The first thing is to monitor your diet. It's important to eliminate or decrease foods or beverages that may irritate your bladder. Some of those beverages include tea, coffee, chocolate, unfortunately, alcohol, caffeinated soft drinks, tomatoes or tomato-based products, spicy and acidic foods, artificial sweeteners, citrus juices, and fruits. You want to actually drink more non-irritating fluids, such as water. This might seem counterintuitive. If you're having trouble getting to the bathroom in time or urinating too often, you might say, Dr. Hartigan, why should I drink more fluid? Well, it's important not to limit your fluids when you have this condition, because the more concentrated your urine is, the more it irritates your bladder. And so by having more dilute urine, you're actually helping your bladder health by helping to prevent urinary tract infections and prevent the urine from being too irritating to the lining of the bladder. However, with that being said, it is important to stop drinking 2 to 3 hours before bedtime to make sure that we're emptying our bladders completely prior to going to sleep at night and limiting the amount of times that we're getting up at night. There are other non-surgical treatment options for urgency urinary incontinence. It's important to avoid constipation and to maintain a healthy weight. If you're a smoker, it's also extremely important to stop smoking. Retraining your bladder can be very important as well. So this includes timed voiding, going to the bathroom every 2 to 3 hours during the day, or double voiding to make sure that you're emptying your bladder completely. Double voiding is when you go to the bathroom, empty your bladder, and then sit there and wait for 30 to 60 seconds and try to go again. Try to get everything out of your bladder. We also have excellent pelvic floor physical therapists at Hunterdon who can help you learn specific exercises and muscle control movements to help retrain your bladder. There are also second-line treatment options for urge urinary incontinence. This includes oral medications and transvaginal estrogen cream. We are lucky enough to have many different oral medication options. However, it's important to discuss each of these with your physician because they might not be the best options for everybody, and each medication needs to be appropriately tailored on an individual basis. It's also well known that many patients, the majority, more than 70%, that start a medication for their urge urinary incontinence or overactive bladder actually discontinue that medication within a couple months, even though we know that this is a chronic, lifelong condition that often will return when you discontinue medication use. The good news is there are other options beyond medicines if those aren't working for you, but it is important to seek treatment and discuss that with a healthcare provider. Third-line treatment options for urge urinary incontinence are actually really wonderful, and most patients don't know that they exist. There are 3 mainstays of third-line treatment options that currently exist. Botox injections into the bladder muscle. This involves a small camera being inserted into the bladder in the office. A very tiny needle is then inserted through the cystoscope, which is the little camera looking inside the bladder, and Botox can be injected directly into the lining of the bladder to help calm the bladder down and prevent leakage prior to getting to the bathroom. This whole procedure takes less than a couple minutes to perform. Another option is sacral nerve stimulation. This is a procedure that involves placement of a pacemaker for your bladder. And then the third option is percutaneous tibial nerve stimulation, which involves a needle electrode placement into the ankle. The nerves that go to the ankle actually cross paths with the nerves that go to the bladder. And this is another way to reset the functioning of the bladder. All of these options may or may not be a possibility for you, but they do exist. And it's important to have an individualized discussion about which one may or may not be the best choice, or if you're even an appropriate candidate for them with a physician. Another type of urinary incontinence is stress urinary incontinence. This is the loss of urine during any movement or activity that puts pressure on the bladder. Examples of those activities include exercising, coughing, sneezing, laughing, lifting heavy objects, or jumping on a trampoline. There are two different causes of stress urinary incontinence, and one person might actually have both as factors in their causes of stress urinary incontinence. The first is hypermobility. This is hypermobility of the urethra. The urethra is the small tube that women pee through from the bladder to the outside world. In men, that tube is much longer, but in women, it's only a few centimeters long. Hypermobility occurs when the bladder neck, and urethra are no longer adequately supported. When this happens, the bladder neck and the urethra move downward under pressure during those activities that we just discussed. Another cause of stress urinary incontinence is intrinsic sphincter deficiency. This is when the actual sphincter muscle of the urethra is unable to close completely, and that leads to urine leakage. This occurs when nerves to the sphincter muscle or the urethral lining itself are damaged or not as robust as it used to be. There are many possible risk factors for stress urinary incontinence as well. Some of those include age and menopause, pregnancy or vaginal childbirth, or even the act of vaginal childbirth attempt with labor. Hysterectomy and pelvic surgery, obesity and weight gain, repetitive physical activity with heavy lifting, smoking, a family history or genetics might lead to stress urinary incontinence, or injuries to the pelvic region or spinal cord. Luckily, there are also several treatment options for stress urinary incontinence as well. Some non-surgical treatment options include pelvic floor exercises like Kegels, pelvic floor physical therapy, and biofeedback. Once again, we have excellent pelvic floor physical therapists within our Hunterdon system that can help you to individualize those muscles and learn how to control them in a better way. Sometimes you need more help than just simply doing your Kegels exercises at home. Non-surgical treatment options also include a vaginal insert. An example of this is a poise impressa. This is like a tampon that you use when you know you're going to be extremely active, and this can help compress the urethra from the vagina and help prevent any additional leakage. Vaginal pessaries also exist, which compress the urethra, and those can be taken in and out. Another minimally invasive treatment option, but procedure-based, is the injection of a urethral bulking agent. This is a no-incision technique, which can be done in the office or with a little bit of sedation in the operating room. It's an outpatient procedure. The way that it works is there's a small camera that I look into the urethra, and a needle goes through the cystoscope, and I can actually inject a material underneath the lining of the urethra to help bulk up that area a bit more and prevent leakage when there's additional pressure pushing down on the bladder from above during certain activities. Again, this is a very simple procedure that can be done in just a few minutes' time. Other treatment options for stress urinary incontinence for the correct patient include a mid-urethral sling or an autologous pubovaginal sling. These are surgical options to help prevent the loss of urine with activities such as coughing, sneezing, or lifting. Mesh slings have been used to treat stress urinary incontinence since 1968 and have been used in millions of women. There is a lot of concern with using mesh products, which I address on an individual basis when we talk about this in the office. But mesh midurethral slings are still considered the gold standard treatment option for stress urinary incontinence in the United States. It's not the correct option for everybody, and it's important to have an individualized conversation, but it is a minimally invasive outpatient procedure, and the majority of patients are continent following a sling procedure. Another option is an autologous pubovaginal sling, and this is similar to a mesh sling. However, this is a procedure where I can actually take a piece of your own tissue and use that as a sling to prevent leakage with coughing, sneezing, and lifting. Mixed incontinence is involuntary bladder leakage, which is associated with both a combination of urge and stress incontinence. Many women have a little bit of both. Treatment options for mixed incontinence may involve treatment options that we discussed for both stress and urge incontinence. However, it's important to establish which symptoms are more bothersome for each patient. This is a very individualized approach to care, and it's important that you and your doctor have a very detailed discussion about what your specific symptoms are and how much it's bothering you before moving forward with any treatment. So what can patients do? Well, you can learn about urinary incontinence, and then you can talk to your physician about any symptoms you're experiencing. You can also see a physician that specializes in urinary incontinence and pelvic floor disorders. That concludes the didactic part of this, but I'm happy to talk about any questions people have. A few questions have already come in, so I'm going to start with those. Our first question is, I heard that peeing in the shower is bad bladder training and could worsen leak tendencies. Not the shower necessarily, but peeing standing up. That we should only pee sitting fully relaxed on the toilet. Is there any merit to this? Well, this is an excellent question, and I love this question because There are so many things that we hear from our friends or family or people that have told us things about peeing before. And since so many people have these problems and don't seek treatment for them, some of these concerns are only addressed with our friends or family. So the short answer is no, it is not bad to pee in the shower. And it's not bad to pee standing up either. 50% of our population pees standing up, right? The men pee standing up and they do just fine. It is important that we have coordination between the pelvic floor and the bladder. In order to have healthy emptying of the bladder, there needs to be a coordinated relaxation of the pelvic floor and contraction of the bladder in order for us to fully empty our bladders. If we don't do that, the bladder can develop a funny rhythm, which can actually lead to overactive bladder and urge urinary incontinence. And so less important is the position in which we're actually urinating, and more important is the coordination between all of our muscles and the ability to fully empty the bladder. So as long as you're able to relax your pelvic floor standing up, it is absolutely fine to continue to pee in the shower. That's not a problem. And peeing in the shower every now and then is also not a problem. But you do want to make sure that you're emptying your bladder fully, because emptying your bladder fully helps to prevent urinary tract infections, bladder stones, and also funny rhythms of bladder contractions. All right, another question that came in. How would you assess and treat a 99-year-old woman who has overactive bladder and is dependent on wearing adult incontinence wear? This is a very tricky question. It's really important, first of all, to do a full evaluation of the patient. It's important to assess, number one, quality of life and how much this is bothering that patient. It's important for me when I'm seeing a patient, first and foremost, to make sure that aside from leakage, the important medical conditions are already addressed. So are they having recurrent urinary tract infections? Are their kidneys protected? Are they having any rashes or cubitus ulcers? These are all very, very important things to make sure that we address prior to even thinking about the leakage itself. Beyond that, it's important to identify when the leakage is happening and why. The person writing this question said, would prefer to not use anticholinergic agents to avoid side effects. And I completely agree with that wholeheartedly. Anticholinergics, for those of you that might not know, are a class of medications that have been around for decades to treat overactive bladder and urge urinary incontinence. This class of medications can work well to address these symptoms. However, there are several significant side effects like dry mouth, dry eyes, and constipation that are very important. Another important side effect that's recently come to light over the last couple of years is that long-term anticholinergic use can actually lead to cognitive deficits and has been linked to dementia. So I personally always try to avoid anticholinergic agents in my elderly population. And I also would prefer to avoid them for anyone that's going to be on medication long-term, because I don't want long-term use of these agents to be linked to dementia in my patients. So there is another class of medications that is available on the market called beta-3 adrenergic agonists. There are two medications within this class that have been FDA approved for these symptoms, and they're both excellent options. However, it's important to look at the individual patient again, what their other medications are, what their other medical problems are, and make sure that it's safe to start one of these medications. In our 99-year-old patient with overactive bladder, in this example, the question writer also says she gets up every 2 to 3 hours to urinate, affecting sleep overnight, and she's exhausted during the day. Yeah, we know that getting up more than 2 times at night significantly affects quality of life. Sometimes sleep apnea really can make a difference here. So I always make sure that for my patients that have nocturia, which is waking up at night to go to the bathroom, that we've fully evaluated them for obstructive sleep apnea and make sure that they're compliant with any CPAP machine or any other treatment option that's been recommended to them prior to moving forward with any additional treatment for urinating over the night. Certainly in this 99-year-old patient, I completely understand the desire to limit invasive procedures, which is what the question writer writes here. So this would have to be a one-on-one conversation where the main goal is to improve quality of life for this patient without putting her at risk for any additional procedures. Another question that came in is, what does Dr. Hartigan think of using the period panties like Thinx, THINX, or Revol, REVOL? as an option for catching occasional leaks instead of traditional disposable incontinence products? Well, I think this is a great option. I think that these products can be really good for the environment and also very cost saving. Like the slide that I showed, the incontinence industry is a big business and these things are not cheap. It can be actually a huge drain from an economic standpoint for patients to be using so many incontinence products. So if you have access to the reusable incontinence wear, I think that this is actually a great option. Another question from a patient came in about interstitial cystitis. Interstitial cystitis is a condition that has many symptoms that can overlap with overactive bladder or urge urinary incontinence, but is also significantly associated with bladder pain. So this specific question from a patient is talking about urgency, frequency, and occasional severe pain with maybe some leakage. And the question writer goes on to ask some specific questions about vaginal atrophy or pelvic floor dysfunction or urinary tract infection, and what to do when some standard medications that could be used for interstitial cystitis aren't working. For this patient, I would say that it's really important that we have a full discussion. My treatment for interstitial cystitis is very, very much individual based, and after having a way more detailed discussion about your personal symptoms and things that you've tried before, as well as some pertinent physical exam and in-office evaluation measures before I could really give any further treatment advice here, but I certainly would recommend that we talk about it and you come see me. And I think hopefully we'd be able to help you. I'd like to really thank everybody for being here today. One other thing that's very important that I let you know is that United Way has a program that actually collects incontinence products and then they go to the Flemington Food Pantry. So as I mentioned before, these products are quite expensive, and it would be great if anyone has any leftover additional incontinence products that you donate them to United Way and help somebody else in need. Feel free to reach out to the organizers of this event for that contact information, should that be something you're interested in. Thank you so much, everybody.